Welcome to the Mental Health Hub. I'm privileged to have you today again. Thank you for keeping it alive, for ensuring that the information that is going out there is benefiting you and benefiting others that need the same. It gives me great pleasure to really be part of this global platform. And today I am privileged to share with an organization, a wellness center. I say wellness center because, as you are aware, which we have discussed before, the word rehabilitation is taking another form because of the stigma at times that is related with the same. So as we know, technology comes on board, creativity, innovativeness, and therefore people are transiting, organizations are transiting from at times calling themselves rehabilitation centers to wellness centers. So I would want us to learn today about a wellness center, what happens in a wellness center, and just to emphasize the fact that treatment works. In terms of mental health, substance use disorders, treatment works. It is more cost effective to do something, to have an intervention than not have an intervention at all. So today, ride with me as we have an opportunity to speak to one professional that has been in this field for a while. Welcome, sir, and let us hear who you are.
Thank you, Pamela. It is an honor to have you with me today. It's an honor for you to visit us and to just share some thoughts as we look at treatment and matters mental health, substance use, and the disorders that accompany it. And to echo just what you're saying, treatment actually works. And substance use disorder being a chronic and relapsing disease, like you put it, inaction might be fatal. I usually tell people it's a time bomb. Not treating it is a time bomb. Mm-hmm. So actually treatment works. So thank you. I'm honored to have you.
Great. Welcome. Let's hear who you are and probably where this nice place we are in is and the name. Tell us, you have been working for a long time in rehabilitation centers. Let's hear this transition to wellness.
All right.
What does it mean?
Asante. My name is Mwathi, James Mwathi. I have not realized. I think because I know you, I'm assuming everybody. My name is James Mwathi. I'm a mental health practitioner, an addictions counselor, psychologist, and everything mental health. Yeah. Like you put it, I've been in this field probably for the last maybe 15 years or so. And I've seen this space grow all the way from when we thought that addiction, as we called it then, was a behavioral issue, and it was treated through behavioral interventions. I remember instances when we used punishment, quote unquote, to try and make people align to what society expects. Yeah. But over time, there has been a big transition. There has been a big awareness, and we now hold addiction, or rather substance use disorders, as a mental health issue. Just the same way, and I've watched some of your podcasts, and I have to thank you for bringing out the information for us to understand that it is a mental illness that can be managed. Just like other physical ailments are managed, just like we manage diabetes and hypertension and all those other illnesses, substance use disorders can also be managed, and somebody can live a full productive life as long as they are well managed. So we've transitioned all the way from behavioral interventions to where we are now using more what we call an eclectic model of treatment. Eclectic simply means that it's an amalgamation of different models of treatment. There is the biopsychosocial, there is a medical model, there is the 12-step that is very common with very many people.
Yeah.
So there is the 12-step program, there is the spiritual program. Yeah. So all this is used to ensure that we deal with the person holistically. Yeah. So yes, this is called JABALI Wellness Center. We've been in existence for about 2 years now. We thought of starting this out to just take care wholesomely of individuals, affording them what I would call a wholesome experience, giving them dignity, ensuring that they feel accepted, ensuring that we involve their families, their workplaces, and everybody else to give them a dignified recovery. So in a nutshell, that is what we do, and that is who we are.
Wow. Dignified. I like the one dignified. I have been privileged to walk around the place, and really there is dignity in it. Dignity, it brings out a family setup, brings out a clean place, brings out an integrated approach to management of substance use disorders. Maybe dignity.
Why the use of dignity?
Yeah.
Now, you will find that, number one, we have to agree that we are all human, and we all, man's number one need is acceptance. Yeah, we crave for acceptance. That's when you join a new place, there is that anxiety because you do not know how you'll be accepted by the people around you and by the different environments. Now, when you look at people who suffer from substance use disorders, society has a lot of stigma towards them. Yeah, and that's why I've said that initially substance use disorders were thought to be behavioral deficiencies. We thought this person is not well mannered, this person is not well behaved, and we will tell them, can't you see why you're doing this? Can't you see your family is suffering? So we stepped on them so much that their self-esteem was affected. And unfortunately, up to this time and age, a lot of people in society still hold this view. Okay? So we intentionally purposed to have a center where whoever comes in with a substance use disorder at first feels accepted. Okay? Because unless that person feels accepted and human, then there will be very little motivation for him to want to change his situation. So we place a lot of emphasis on the dignity part for the person to feel, I can do this. Because some people have been so stigmatized by society that they've lost the self-belief. They do not actually believe that they can be able to stay without using. Yeah. So the first thing that we do is ensure that we allow the person to understand that what they're suffering from is not a behavioral issue. It is a disease like any other. It can be managed, and there are people who accept them as they are. So that's why we emphasize a lot on the dignity part.
On the dignity of the person.
Yes.
And you have put it right that society views this person with a lot of shame to some extent, stigmatizing them. It's like, why can't you change? Why did you choose to be this? You know, without that understanding that this is a disease. And the emphasis you have put, really, it's a disease like any other that can be managed. You have brought up the bit of even this person themselves probably has lost dignity. I don't know how you help this person to restore their dignity, especially starting with themselves before the society views them differently.
One view that I hold dearly, and I encourage and I talk to each person who comes through our gates, is that addiction, and you will allow me to use that term, although I run away from it.
Sure.
But addiction is not your responsibility. You did not wake up one day and intentionally choose to be addicted to a substance or a habit, especially if it is a defective habit. Okay? But recovery is your sole responsibility.
Uh-huh.
Yeah.
So getting into the disease is
You did not choose.
your responsibility.
It is not your responsibility. And why do I say this? Very many people, when you look into the pathways through which they get into these substance use disorders, they were just like any other person. They were experimenting. They were having a good time.
Yeah.
There was no intention to get hooked. But you got hooked.
Okay.
So we will not keep on looking backwards and saying, why did I? It was my fault. No, it happened.
Yeah.
But now recovery going forward, it is your sole responsibility. So the first thing is to ensure that the client understands that. So that we can close that chapter. Why did you do? Why did you? So can we focus going forward?
You are not being blamed for
You're not
being
blamed.
here now.
Yes. Whatever pathways that led you to us, you're here now.
Yeah.
Let's accept you're here. Now let's forge ways to move forward. Yeah. Now, when you look at a person, again, they were not born an addict. So they must have had some milestones in their lives.
Sure.
So these are the things that you amplify so that the client starts understanding that actually, minus the alcohol, minus the cannabis, minus the everything else that I use, I can achieve
I am a
because
person.
I have done it before. So yes, this substance came into the picture at some point. It caused some considerable pain. It caused some shame. It caused some all that. But you can actually be able to surmount all that and move forward. So that is and you see, our program will be divided into different parts, maybe 3 main segments. So month 1, for example, if one was to do a 3-month program, month 1 is just to make sure that the clients understands what they're suffering from, because some of us are not able to stop because we do not even understand what we are dealing with.
Yeah, true.
Yeah. So we do a lot of psychoeducation and a lot of individual therapy to ensure that the client or the patient understands what they're suffering from. Number 2, ensure that they understand it is not about them. You do not choose to get diabetes. You do not choose. So why is it that we hold our clients, our people, responsible for getting addicted? So just like any other disease, it is not about you. Okay? And then number 3, it is instilling in them the belief that you can beat this because other people have done it. Yeah. In our program, you will find that we incorporate a lot of people who have been in the program before, who can just come and let other people know that I have done 1 month out there.
Wow.
I have done 2 months, I've done 1 year. Yeah. Because most people, when they see others do it, they start developing that belief that it is actually possible.
Wow.
Yes.
So that is month 1,
Psychoeducation.
psychoeducation.
Yes. So month 1, mostly psychoeducation, a lot of assessments go into place. Again, you'll find that most substance use disorders will occur with other psychiatric disorders. Yeah. So we'll do assessments for mood disorders, for psychotic disorders, for all others. Yeah. Why is this important? Because if you treat the substance use disorder alone and you ignore a possible other disorder, then chances of a relapse are very high. Because some people do what, and I think I've heard you mention it in your podcast, some people do self-medicating. They have a depressive illness that has never been diagnosed, so they chance upon a substance that alleviates those symptoms.
Relief.
It gives them some comfort, some relief,
Yeah.
and it becomes a habit. So if he comes to you with this habit and you do not sort the other underlying issue, then chances are they will relapse. So month 1 also has a lot of assessments. Then month 2, we incorporate, now we bring in the family, we bring in the workplace, we bring in to try and mitigate what has been happening in this person's life. Yeah. The psychoeducation is still ongoing, but now in this second phase, we incorporate other people now. Why is this important? Man is a social animal.
Yeah,
we do not live in isolation. Yeah.
They came from family,
they came from society, somewhere, exactly.
From a workplace,
and they will go back there.
Yeah.
So it is important, again, even to reduce the stigma, because we do not want this client, once they are discharged, they go back to a situation or an environment where people do not understand them. So we integrated the environments into treatment. And then month 3, we mostly focus on what we call exit planning. So we ensure that we have a purpose and a plan for when this person is discharged. So that's a very compressed way of looking at a 3-month program.
In this exit plan, what are the aspects that probably the client will be looking at as they exit?
Trigger identification, trigger management, coping skills, integrating the family and the workplace to give them a comfortable landing space when they come back to your environment. Yeah. So it's more about just being aware of what to expect now that you're coming out a different person from the person you came in, what to expect out there and how to deal with what you expect. Yeah.
From your experience in terms of working with clients for this period, what really do most of them pick as the likely thing that would make them relapse? Or
fear of the unknown. For lack of a better word, fear of the unknown. Again, remember, there's something that I call familiar pain. By the time this client comes to us, they know they have a problem. They know it is causing them distress. They know it is making them come into conflict with different people. But they know the patterns. So they know I will drink, I will have problems at my work, I'll get a warning letter, I will behave. After 2 months, things will be okay. So it is a familiar cycle. Exactly. But then now you're telling this person, move away from what you know to the unknown. Remember, back then, any uncomfortable feelings they would deal with through using. But now you're telling them, life will not stop for you. Life will not bend over backwards for you.
No.
You will still have challenges, but you can't use what you're using. So that fear of the unknown usually makes them a bit ambivalent.
How will it be out there without what I was used to as a coping mechanism?
And that's why, again, part of phase 2, the second month, you'll find that we will try and equip them with coping skills and coping mechanisms and life skills. Because you are re-socializing this person again.
Taking them back to the society where they came from, or launching them out there after being in a controlled environment for a while.
Yes. Wow. It's not easy, and that's why you see treatment does not end on discharge.
I like that bit.
Treatment does not end on discharge because they are transitioning now to a different environment. You need very close follow-ups with them to ensure that the challenges that they meet out there, you are able to mitigate. So you will find that when we are discharging and part of exit planning, we will plan a lot of aftercare sessions. And depending on the number of challenges and the personality of the person, you will find some will have intense sessions, maybe twice weekly after discharge. Others will have one weekly, others will have one every 2 weeks. So depending on the challenges that we expect and the personality of a person, and then we stagger them. After a while, the more they continue now building blocks out there and building coping mechanisms, we disengage slowly, because again, you do not want these people becoming dependent on their therapists.
Great. You brought the aspect of therapists. In the treatment, who are the professionals probably involved with these clients that come in?
Wow. Now, dealing with human life,
yes.
A lot of professionals are. Any treatment will involve a multidisciplinary team. There will be the psychiatrists. Substance use disorders is a mental disorder. So there has to be involvement of a psychiatrist. There will be a primary psychologist or a counselor. Yeah? This is the person who, from day one up to discharge, they will work with this patient. They will try and identify what is the root cause of the problem, why do you drink or use whatever you use, the way you use, all that. So they will be involved in family sessions, all that. There is the psychiatric nurse to take care of their everyday health issues while they're in treatment. There will be a social worker to help integrate them back. Yeah? There will be the resident counselor. There are very many now professionals just to ensure that this client is comfortable while they're here. But the emphasis is one person cannot play all these roles. There is the role of the psychiatrist, there is the role of the counselor, there is the role of the social worker. Each person has their role, and if this is followed, then that is best practices across the world.
Best practices. You brought in professionalizing the entire treatment process, and I'm looking at it and wondering, these therapists or the psychologist, the counselor who is working with the client, what do you look out for in this person probably? Because it seems it's quite a good work for the counselor. Yeah.
No, for you to get into the psychologist position, you have to be a bachelor's holder of preferably psychology. Once you're with us, we will take you through some training that enables you suit into this particular field.
Okay.
We will expect you to do some continuous education. We will expect you to be enrolled in some professional bodies, example ISAP. Yes, so continuous education and the professional bodies. And
that helps also the counselor to be okay.
Be okay, yes. No, we expect now part of the roles and expectations and responsibilities. We expect the therapist also to do personal therapy. Again, this is not an easy field. You're carrying a lot on your shoulder.
Yeah.
So every so often we will want them to disengage, seek personal therapy, because they cannot treat others if they are not well themselves. You have to be well to offer help. Yeah.
You have to be a proper helper.
Yes.
For you to really actually be able to
be effective.
To be effective.
Yes.
And for sustainability of even this recovery, as you say, it's like you mentioned, it's a lifelong.
It is a journey. It is a journey. I usually, whenever I get an opportunity to speak, I usually tell people, it is not a one quick fix thing. You will have to work with your client for quite a long period. Again, considering the fact that substance use disorders are not curable, they are manageable. You cannot take medication and now I'm good, I'm cured, I can now control my drink. Yeah. So this is a journey that we might have to walk. Not we might. We will walk for life.
We will have to walk for life. Yes. And you talked about the quick fix, eh? And you know out there, when we bring our people for this kind of treatment, it's like, I want you to go there, and by the time you come out here, you should be a changed person.
I do not blame families.
Yes.
I do not blame families. Because there is a lot of lack of education out there. Most people do not understand what substance use disorder is. Most people do not understand what happens in treatment. So what we do is we expect that kind of expectation from the people who bring their people here.
Yeah.
We involve them a lot in psychoeducation to even understand the disease they are dealing with. Yeah. So we expect that when they are bringing them in. But when their loved one is in treatment, we do a lot of psychoeducation, a lot of family sessions to just try and, even before they understand their person, to understand the disease. Once they understand the disease, now we can look at the disease in relation to their person. So it's not, we usually say the person who comes to us is the identified patient. But when we have a substance use disorder in a family, everybody is affected at different levels.
What?
And everybody affects the prognosis of this person.
Everybody in that family
is affected one way or the other. And everybody affects how well this person recovers. So it is the role of the therapist to look at the client and then the family, and then know in person A, I'll deal with them this way. In this client's family, person B needs this kind of therapy, person C, and so on and so on. So it's a lot of work that goes on in treatment. It's not just focused on the client, but the client and his different environments. And different environments is family, work, everything. So you might find a person comes and we recommend transferring from department A, take him to department B, transferring from this to workstation, take him to the different workstation. Because again, we all cope differently. I
wish out there we are hearing what what this is all about. Because I have experienced a situation where we are taking our people for treatment. First of all, we have stigmatized them. They have self-stigmatized. Life is complex without seeing the complexity of this disease as you bring it out. I don't know what you like the world out there to hear.
What I would say is, number one, information has started getting out there. So we are better where we are today than where we were yesterday.
That's a nice one.
Number two, substance use disorders are manageable conditions. Somebody can go through treatment and become a productive member of society. Number three, it's important for us to understand that by nature, these disorders are progressive. So that means where we are today in terms of the disorder is not where we'll be tomorrow. It gets worse with each passing day. So the earlier we take action, the better the outcome for the person. And number three, there are professionals in this country. I remember a time when we would go to SA, whenever we thought treatment, it was outside the country.
True.
But now we have the right professionals, we have the right, all multidisciplinary teams. So it is possible and there is help.
Well, there is help out there, you hear, that a lot has happened. We have grown as a country in terms of management of substance use disorders. Information is out there. The professionals are trying to pass information as much as possible. Resources are available. It's for you and me to reach out for help. And of course, not give up. It is a lifelong treatment. Remember that you have a part to play in this. Even as the professionals do their best, even as the clients that you bring to them try to reinvent themselves, if you want me to use that one. This is somebody comes in completely in a different format. And it's like you have to try and reformat them for the world again. Or try and help them to reformat themselves, isn't it? Try help them to reformat themselves. Get
resocializing. That's the word. You're socializing them again because they had a way of dealing with the world. You're asking them to discard that way because it was dysfunctional and adopt a new system of dealing with the world.
That they can fit out there, be resourceful as Mr. Mwathi has indicated, because at the end of the day, everyone counts. Every life counts. I've always reminded us that health is a human right, and everyone has a right to quality health. You have a responsibility as an individual to ensure that you don't initiate substance use. You have a responsibility to stay on treatment if you have already initiated and you are getting the support for recovery. As family, you also have a role to play in ensuring that your loved one is supported. It is not an easy thing. It is costly, as you have heard Mr. Mwathi points out. It is lifelong. I hope that we can be able to really stay on course and ensure that we are restoring our people back to functionality, so that then our nation stop losing the resources that we need. Treatment works. See you next time.